and welcome to the Australian Spinal Research Foundation. I'm here with Tanja Glucina, who many of you would have seen on an interview with Craig Foote just recently about talking about her PhD. Dr. Tanja has just gotten the first paper out of her PhD published, and so she's here to talk with us about that today. How are you, Dr. Tanja?
I'm fabulous, thank you. How are you?
Very good. The paper was published in the Journal of Complementary Therapies in Clinical Practice, and it was talking about moving towards a contemporary identity for the chiropractic profession. What a task to take on. How do you even start that process?
Oh, yes, no, it is big. You kind of come up with your keywords, you come up with what are you actually looking for, and then you just look at the literature and you just examine it for commonalities. And you just go, what's this saying?
Mm-hmm. So obviously there's a mountain of data that you've had to go through in order to nail down the key areas that came up in this study. I was very interested to find there was a few key areas that came up. One of them was scope of practice, and then another was there was kind of the musculoskeletal, there was the vitalist, there was the centrists, and I was so curious to see that only about 20% of chiropractors were talking in terms of vertebral subluxation. So
as an exclusive clinical practice focus. Yeah.
So talk to me more about that, those three identities. Does it mainly affect the way chiropractors view themselves, or is there a real bearing on the patient, the individual under care?
Yeah. So with respect to scope of practice, because this paper, this study was looking at international professional identity for the chiropractic profession, because it's under jurisdictional control. That's my dog barking. Can you hear him? Okay. It's very, very varied across all countries. So scope of practice is really quite individual to a particular region.
Mm-hmm.
As opposed to these subtypes. So we've always known within chiropractic, historically, there's always been this debate of the biomechanical versus the vitalist chiropractor, the musculoskeletal and the subluxation chiropractor. And then we've known that there's this bunch in the middle called the centrists. So it was really interesting to actually look at what does the data say, because there's so much commentary and there's so much talk and there's so much heated discussion, but what is the actual research? What research has actually been done?
Mm-hmm.
And it was very interesting to see that, like you mentioned, 20% have an exclusive vertebral subluxation based focus. But to me, what was more interesting was that 70% of chiropractors, it's an important practice consideration.
Okay.
So even, so this is that centrist group. So the centrist group is huge. That's not to say that the centrist group, that if you do the math, that means that 10% of the musculoskeletal based ones. It doesn't work that way. It's more that no matter what kind of a chiropractor you are, and across many papers, up to 70% stated philosophy to be important, subluxation to be important, and it's something that they're looking at, as well as looking at an individual's symptomatic picture and their symptomatology as well. So that was really interesting to me.
Yeah, so I guess this could be a moment to kind of pause and think about what the greater things that unite us than divide us, I suppose, because if 20% are exclusive, and it's a bit of a Venn diagram, isn't it? The vertebral subluxation only, and then the centrist group. So, and then we'd have what, 30% out over on the muscular?
Yeah, do you know, there was no, I couldn't really, well, this is where it gets a bit complicated, and I invite the fabulous viewers here to read the paper because it's going to be hard to summarize. But in reality, certain papers have actually grouped what they call unorthodox chiropractic to be the vertebral subluxation based ones. And this is the 20% that we're talking about. And then they're saying that 80% are the orthodox. But if you look at the actual paper, or papers and how they've come to this, there are some potential flaws to their categorization process, as well as in one paper, for example, they've got 6 groups and they classify 5 to be the orthodox and 1 to be the unorthodox. So, I can't really comment on what that number is, because you have to read the paper and then you can come up with your own conclusions as to what that means. Yeah, you made a comment just previously about this diversity within chiropractic, and for me, what really came out of this paper was a curious question, which is our current entire culture across many platform in this universe, in our world, I should say, is all about embrace diversity.
Yes.
And it's just so fascinating that within chiropractic we haven't evolved to that level yet, it seems, potentially, where we really are able to look at what we offer in a respectful and and I think that's our real strength. And so a question that's come from this is, how do we create that, perhaps?
Yeah, and I think that's the challenge, isn't it? Like, and where do you take the research after a paper like this that kind of like lays it all out, all of these different ways of thinking? How do we then explore the diversity? And that's not a question I kind of expect you to answer.
My PhD is.
Oh,
that's what I'm looking at. Yeah.
Okay.
So this paper is the background to my PhD. So this paper is my literature review to essentially create the foundation for the work that I'm about to be embarking on.
Yeah.
And it's looking at, shall I talk about that?
Yeah, go for it.
Yeah.
Go for
So
it.
basically, the first study is looking at chiropractors' perspectives on professional identity and essentially asking them questions around where does chiropractic sit within healthcare, how do they speak and communicate to their patients, their practice members, those types of questions. And then, looking at, are there potentially some kind of subtypes and what does that look like? Then asking patients similar types of questions, not quite as detailed, but, what do the patients perceive chiropractic to be? And one of my underlying kind of, I'm curious, do they even know about these subtypes? I'm not going to, do they know? What do the patients think of chiropractic as a profession for our identity in healthcare as well? Then thirdly, I'll be proposing a model of contemporary practice. So essentially looking at chiropractors' perspectives and what they'd said, looking at patients and then seeing how can we come up with something together as such. And then lastly, I'm going to be looking at the practitioner subtypes and then looking if there's any effect on patient health outcomes. So there's going to be, so it's a quantitative study and seeing, does somebody who's self-selected to be a vital, let's just say looking at what the literature has told us, let's assume that there's 3, there could be 5, I don't know because I haven't done the studies yet, but if we look at historically what's been done is the 3 being the vitalist, I hate even using those words, sorry, but you know what I mean, these 3 subtypes. Let's see if this makes a difference to the patients in health-related quality of life, therapeutic alliance, and various symptomatic pictures as well. So I'll be looking at using regression models and seeing, is there an impact there? So I'm very curious to see.
Now, this, of course, harks me back to some earlier work you did on quality of life. And I remember a comment you made was that it's not a tool that is used very easily because people don't know how to communicate it. And I guess as a chiropractic communicator, that floats my boat. But really all the work you're doing here is setting up the groundwork for us to be able to reach so many more people in need of chiropractic care because we understand better.
Is it that obvious? Is that what I'm doing? Is definitely a part of, if that could be created with some collaboration, that would be fabulous, for our profession, for healthcare.
Look, I'm really excited about, I'm excited about when chiropractors do PhDs, and I'm excited about when chiropractors pump out more research. So it was a fascinating paper to read. So again, it is across at the Journal of Complementary Therapies in Clinical Practice. I'll pop the link below this video. So make sure you jump across and check out this study so that you can read all of the numbers there. And I can't wait to see what the next paper to fall out of this PhD ADHD is, because it's a really important topic, and it's one that really floats our boat, obviously, because we're all about research and vertebral subluxation and understanding all of the parameters that we're working with there. So thank you, Dr. Tanja.
And can I also just say thank you to this Australian Spinal Research Foundation for supporting my research, as well as everything that we do at the Centre for Chiropractic Research at the New Zealand College of Chiropractic, and all the research that you support across all the platforms and people and individuals and groups that you do. Because without you, we can't do what we do. So thank you.
It is absolutely our honour, and I guess the message there is we need researchers, and we also need people to get behind the efforts to fund it. So thank you very much, Dr. Tanja.